Hello and welcome to UK Fitness Hub. My name's Travis Tarrant and today we're going to be going through stretches and exercises for cervical spondylosis. Let's get into it. So cervical spondylosis is a common condition that affects the joints and discs within your cervical spine. And the cervical spine is just the spine of the neck. So the part, I've got it in my hand here, the purple part, and you'll see here you've got 7 little sprongs coming out from the side. You've got 7 vertebrae in your cervical spine, so right at the top. And this model's quite nice because you can actually see where it ends and starts. Now, the common thing that people will say about this is that it's an age-related condition, and I have to agree when it comes to the chances of getting it are higher with age. However, that doesn't mean to say you can't have cervical spondylosis when you're 20 and 30. So to say it's an age-related condition, I think is quite misleading, but certainly the chances are higher the older you get. Most people have cervical spondylosis and they don't even know about it. So if you was to take, for example, a group of 60-plus-year-olds with no pain whatsoever within their neck, the chances are that there would be some of them with arthritis of the neck and general wear and tear. And that's all cervical spondylosis is, it's wear and tear of the neck. Now, if you actually have a look at this diagram here and this anatomical structure, you'll notice you've got vertebrae and then these little discs, and they're gel-like. Now, these play a really important role in the body in absorbing shock, allowing us to freely rotate and move. And sometimes these discs can either become herniated, they can leak, they can get dehydrated, and with wear and tear, rather than there being this nice little cushion in between each vertebrae, they actually start to wear so much that it's bone-on-bone contact. So rather than vertebrae, disc vertebrae, it's vertebrae to vertebrae, and that can often cause people not to have that range of movement in their neck. So what we're going to try and do is we're going to try and target specifically the neck, get more range of movement or as much as we can, and try to improve that over time. What we can also do is stretch out the muscles that attach onto the cervical spine because they might be tight along with the ligaments that attach as well. So let's get into some of those stretches and exercises that we can do to help relieve pain of cervical spondylosis.
Our first exercise is a side-to-side movement. Begin facing forwards with your shoulders back, then slowly turn your head to the side, keeping your torso still facing forwards as you do this. Look to achieve the maximum range of motion and then return back to centre before repeating on the opposite side. This is a good assessment to see if one side is tighter than the other, and as time goes on you want to improve your range of motion. If you experience any type of pain or discomfort, only go to as far as you can and work within the range that's suitable for you. Make sure to do 10 repetitions for 2 sets on each side. Next up is an active neck side bend. Keep the same start position as previously, looking forward with upright posture and your shoulders back. I want you to try and imagine you're bringing your ear as close to your shoulder as possible. It's common to see people cheat on this one, so in this video I've actually got my hands grasped onto a chair leg to make sure that my shoulders can't hoik up. You can do exactly the same with putting your hands underneath your bottom. Repeat this for 10 repetitions on each side for 2 sets over. So we've covered rotation and side bending, so of course next up has to be flexion and extension. Bring your chin to your chest to stretch out the muscles at the back of your neck, then slowly reverse the movement to bring your chin up as high as possible and as high as comfortable to stretch out the front of the neck. At this stage of the movement, with your chin as high as is comfortable, begin to turn your head to the side. This targets a muscle called the sternocleidomastoid at the front of your neck. This muscle plays a big role in allowing the head to flex and side bend, and often gets tight. The nerve origins of this muscle attach right at the top of the neck, and tightness over time can cause these nerves to compress. Repeat this movement for 10 repetitions 3 times over. Next up is an isometric neck flexion. Well, firstly, what does that even mean? Well, an isometric muscle contraction is one that is static. In other words, the type of contraction that has no visible movement. To start, interlink your fingers and bring them below your chin. Try to push your chin down as hard as you can, as if you was trying to move your chin to your chest. With your hand, you're going to resist this movement, so there's no physical movement during the exercise. You should still, however, feel your frontal neck muscles contract and tighten up. Hold this for 5 seconds, have a little break, hold it for another 5 seconds until you complete a total of 25 seconds. So that's 5 segments. Once you've done this, repeat it 2 more times to make 3 sets. Now let's get on to some direct stretching. The first stretch is for your upper trapezius. Now this is something we've probably all done out of natural instinct, especially when we try to stretch our neck after a bad night's sleep. Firstly, raise your hand up and place it on the opposite side of your head, then begin to pull gently towards the opposite direction. As you do this, ensure your free hand is clasping a chair leg or underneath your bottom if you're sitting down to avoid hoiking of the shoulder as per mentioned earlier. Hold this stretch for 30 seconds, 2 times over. Now let's move on to stretching out the levator scapula. Place your hand at the furthest corner behind your head. So for example, if I was using my right hand, I'll be placing it on the far left corner of my head. Begin to pull the head down towards your opposite knee. So taking that previous example, I would take my right hand, place it behind my head on the furthest left-hand corner, then proceed to pull towards my right knee. Hold this for 30 seconds, 2 times over on both sides. If you've never heard of the levator scapula, it helps to raise the scapula and assists in side bending of the neck. So for those who get stressed and tighten up posturally, as a result, you might be prone to having tight levator scapular muscles. There's definitely a correlation between patients I see with arthritis of the neck and forward head posture. So this next exercise, chin tucks, is going to target just that. We spend so much of our time craning our neck down, looking at laptops and phones, which causes huge muscular imbalances. To begin doing a chin tuck, lay down flat with your hands by your sides. Start with your head in a neutral position, then begin to draw your chin to your chest slowly. Pause when you can no longer go any further before repeating this for 15 repetitions, 2 sets over. Chin tucks help to strengthen the deep cervical flexors and lower cervical extensors. A big cause of general neck pain is severe muscular imbalances, and when this is chronically bad, it can cause inhibited range of movement as well as headaches. In some cases, when this is severe, it can cause kyphosis, which is your typical hunchback posture. Leading on nicely from our previous exercise is chin holds. Begin in the same position as previous, however this time you're going to take both your hands behind your neck and straighten out your spine. If you look at the gap between my neck and the floor when I start, I'm trying to greatly reduce this as much as possible when I place both my hands behind my head and try to bring my chin all the way to my chest, or as much as I can. This is a great relief for those struggling with poor head posture, and I do this stretch daily myself. You might be wondering how often to do all these stretches and exercises, and to start off I recommend doing them once daily, and then you can progress this to 2 times, specifically morning and night.
And that concludes the end of today's video. Thank you very much for watching, and if you have enjoyed it or learned something new, please leave a like on the video and please subscribe as well. It helps grow my channel, which is a brand new channel trying to help as many people as possible with physiotherapy based content. If you've got any questions for me, please leave them in the comments box and I'll try to get back to them as soon as possible. You've been watching UK Fitness Hub. My name's Travis Tarrant and I'll see you soon.